Welcome to the launch of the Brent Self-Neglect Toolkit. This is a person-centred, solution-focused approach. I am Nikki Brownjohn and I'm the Independent Chair for Brent Safeguarding Adults Board. And this is a webinar based on the launch event for the Self-Neglect Toolkit that took place on the 1st of October 2025. So what we were going to look at during this webinar is, why is self-neglect important in safeguarding? What do we need to do to support those who self-neglect? Considering the toolkit itself and looking at some accompanying resources. We'll have maybe some reflections from myself, but on the day of the launch, we did have questions, but we've done this session separately to that day. So why is self-neglect an important issue in safeguarding adults? Last year there was the second National Safeguarding Adults Review analysis published, and this looked at all of the Safeguarding Adults reviews that had been commissioned by Safeguarding Adults boards across England over the previous 3 years. And this highlighted that self-neglect was the most common feature in Safeguarding Adults reviews. So that doesn't necessarily mean to say that it's the most common feature in adult safeguarding, but it's the issue that seems to be challenging the most. What do we do about self-neglect? So I'm going to look at some of the findings from this second National SAR analysis, and which focus in on self-neglect. And I think that will really help us to come to some conclusions about what we need to do next. One of the areas that one of the findings of the SAR analysis was around assessment. And what the reviewers found was that in several cases of severe self-neglect, there was no evident consideration of the suitability and impact of the observed home environment, or how it had descended into such a neglected state. So this really makes us think about how we assess people that we're working with. What is it that they're living in? How is that affecting how they are living, and how safe they are? The second area was around understanding the person. And what the reviewers in the analysis found was that in Safeguarding Adults reviews, it showed that little was known about what the individuals concerned really thought about their situation and what their desired outcomes were. And the causes of this weren't explored either, and this links with the assessment in the previous slide. The focus remained on the symptoms. So this really sort of feels to me that, and these are national reviews, not Brent, is about how we tend to do to the individual, do to the person, rather than really getting underneath who they are, what their story is, what their life story is, and what they want from their lives. So we just see either the person themselves in a very poor state of health, of poor hygiene, of dirty clothes, maybe the mental health isn't good, and then not engaging with any services that they need. So that's might be what we see. Or if they're hoarding, we might just see a home in a really, really severe state that is totally unlivable. We don't understand how the person got there and what they think they could do, what they want to do to be able to get out of that situation, or do they really want to get out of it? So there's something there. The next area takes us on from understanding the person into the impact of life experience. So we don't ask about the person's life story. And there seemed to be a tendency with the reviews undertaken that what the reviewers found was that the unwise decisions principle seemed to underpin the practitioner's conclusions in some situations, that an individual's behaviour arose from a lifestyle choice. So this is a concept that might have been applied in a range of circumstances, including self-neglect, but also those who were misusing drugs, sex work, or alcohol dependency. So again, that links with that previous slide around understanding the person. It also links with the first slide around assessment, is about how do we view the person who's in front of us about what they're doing? Do we just think it's a lifestyle choice? That's why the person's wearing that, rather than thinking about what's happened to that person to get them to this point. So as I said earlier, around that life story, that storytelling, what opportunities do we give? What time do we give to somebody being able to tell their story when we're first working with them, when we're undertaking that initial assessment, and then when we return to do further assessments and develop our relationship? How are we understanding their life story? The next aspect that the analysis looked at in regards to self-neglect was who cares. And what they found was that there was a failure to recognise the interface between self-neglect and neglect by family carers. For me, that's saying something about when we go into a home, we're dealing a lot with informal unpaid carers. So how do we work with them and with the person themselves with the care and support needs to understand what's going on, who is caring, how are they caring, and who is making decisions? So if the person themselves thinks that they're actually looking after themselves, or that they thought the family member was providing them care, but they're not really. So I think for another webinar perhaps is to talk about neglect and informal carers. How are we understanding that? Is it because self-neglect or neglect occurring because we're not able to recognise and have the resources to hear and see how this family situation, that they're not coping, that they need some external support to prevent that self-neglect or to prevent the neglect. Another area that the analysis found was that in some of the reviews, people had debilitating illnesses. What they found was that in those situations, there was poor recognition of certain aspects of risk. For example, self-neglect relating to health needs, and that it's not being identified within an overview or overall picture of self-neglect. So if somebody has a chronic illness, they maybe have been working on it, just coping with it, managing it themselves for years, could be decades, but something's happened. Maybe they've had a second illness, or maybe that chronic illness as they've gone into an acute phase. So they might be seen as just self-neglecting, with a lack of understanding from professionals about actually what health needs need to be addressed. It might be that previously the person has been able to say no to some of the health support that's on offer, that manage their illness within primary care, but maybe now they do need that more acute, that secondary care input. So how are we dealing with that? Or are we just seeing somebody in front of us clearly self-neglecting and they haven't come to appointments, but actually there's more to it than that? Another area that those who had undertook this analysis found that within the Safeguarding Adults reviews, safeguarding obviously came up. What the reviews found was that even extreme self-neglect had often not been referred into safeguarding. Sometimes this was through lack of recognition that it was a form of abuse and neglect covered by safeguarding duties. Sometimes we get situations where somebody seems to be self-neglecting, but it's at the very early stages, and that is referred in. So that's an interesting one, that we have our safeguarding duties, and so why would we not refer in self-neglect, particularly if it's extreme? So who is it who's involved with the person, who's working with them, and how are they coming to that conclusion? What assessments are they undertaking? In the analysis, alcohol dependency, effect of healthcare and self-harm was sometimes not recognised as forms of self-neglect that warranted a safeguarding referral. So with alcohol dependency, who is working with those who might be dependent on alcohol, and when does it slide into self-neglect, and when does it become extreme? The neglect of healthcare. We talk about in the toolkit some of the indicators of self-neglect might be not engaging with healthcare services, but is it as simple as the person choosing not to attend a healthcare appointment, and so then their physical health it starts to deteriorate. Is that really self-neglect? But it might warrant a safeguarding referral. There's something going on there. If they don't have that healthcare, then they could die. And so therefore, we have to consider what is our role in that situation. So we don't wrap adults in cotton wool, but if they've got care and support needs and they're at risk of harm due to themselves or from others, then should we not be considering a safeguarding referral that either leads to a statutory safeguarding inquiry or some other thinking across the multi-agency system? Legal literacy, which comes up in most safeguarding adults reviews now, that there seems to be a lack of shared understanding across all agencies of the legislative options available to intervene to safeguard a person who's self-neglecting. And legal literacy comes up in other areas as well as self-neglect, but it's not always a pure case of this person has the capacity under the Mental Capacity Act to make this decision to not let us in, to address the signs of hoarding and that it's becoming, the home is becoming unlivable. That's not enough. There are other legal options that we can consider. So, for example, if the home is not just purely becoming a risk to the person themselves, but to other people in the home or outside of the home, then it's not enough. It's not sufficient for us to just say they're not cooperating, they're not engaging, and so there's nothing we can do. We need to be thinking together, not just one agency, but together about what can we do and who has the power to do that. And so that really brings in the sort of work that we need to do together. So that was summary of what I pulled out, and that was my personal view on the findings from the National SAR analysis. And that is available on the ADAS website. The lead author was Michael Preston Shute, so that's very easy to find. So now this session was to launch the Brent Self-Neglect Toolkit. And so I'm just going to go through some headlines from it, really. I can't share the whole tool during this webinar, and it is accessible on the Brent Safeguarding Partnerships website. So please do look at it, and it also has some other resources as well. What does the toolkit do? So the purpose is about helping us to work with those who self-neglect or hoard. This is a screenshot from the toolkit explaining what self-neglect is. So self-neglect is when an adult fails, either intentionally or unintentionally, to meet their own essential needs for health, safety and well-being. It can include neglecting personal hygiene, nutrition, medical care, or maintaining a safe living environment. And this behaviour may put the person's health, safety or even life at risk. Causes can be varied and often complex, just as explained from some of the findings from the SAR analysis. It can feature physical health problems, cognitive impairments, mental health conditions, substance misuse, grief, trauma, cultural or personal beliefs, or the impact of long-term isolation. And for some, it can reflect a conscious lifestyle choice, but for others, can be linked to a loss of capacity, coping difficulties, or a decline in executive functioning. So it's not just a binary finding there. We have to stop and think about what's going on here to be able to find a solution or conclusion. So the toolkit, I think a really major part of it is about the tips for engagement with people who appear to be neglecting themselves. So this really sort of identifies before the crisis, what can we do? Now, hopefully we're getting in very early, so that prevention time to prevent a serious self-neglect. Or it might be that we have been called in and it is the time of crisis, but we can't just go diving in, making decisions for the person, because we won't get it far. We might manage that crisis, but in the long term, we will have disengaged that person. So the first tip is about building rapport. So it's about building rapport and learning when the self-neglect began. Again, this links with the findings from the SAR analysis. Were things ever different? What led to a change? It's good to avoid discussing solutions at this point until the trust is established. That early intervention makes change more achievable. Really sort of giving them that time and just getting to know the person, what makes them tick, and how can you get them to open the door, answer the phone, and get you over the threshold. Second tip is around social connection. Being able to talk to the person, to identify past activities, work or education. What did the person enjoy? What made them in life? So that might be supporting that social connection and some structure that can help them reflect on their situation. And this might reduce the impact of any trauma or loss or neglect that they've experienced. The third tip is around self-esteem, exploring how the person feels about themselves and their living situation, including the reasons behind it. I think particularly if we're talking around hoarding, is understanding their emotional attachment to items and what feelings or needs the current situation may be fulfilling. So, for example, it might be that they've suffered a significant bereavement, and maybe one of their parents has died, and so they've inherited a lot of their parents. Much of that could have been destroyed, but there's something about that memory, that feeling, that connection with their parent who's died. So we can't just go in and remove all of those items. We need to understand what the emotional attachment is to those items. The fourth tip is around taking your time. And I think I've said this already, but time is so important, just to take gradual steps with plenty of encouragement, focus on the safety and well-being, but being able to collaborate with the person to make them make that decision about what needs to be done to make the environment safe, or what they need to do first. They're going to need positive reinforcement throughout. They might take one step forward and two steps back, but it's about empowering them to be able to take control of their lives. The fifth tip is around a strengths-based approach. So using a strengths-based approach to identify the person's positive qualities and their preferred way to manage risk, but document capacity and consent clearly. In really encouraging that self-awareness and empowering that positive change by focusing in on their strengths. That will then takes us back to building that rapport with them if we've been able to take that time and not judge them really, but everybody can, a very bad experience, a traumatic experience that leads them into not living in the way that they might have wanted to in the past. So another section in the toolkit is around assessing self-neglect and hoarding. This sets out the key expectations for multi-agency working. And I think anybody who's watching this webinar, the real takeaways for this is around those tips for engagement, about really sort of taking that time to engage with the person. But then the next area is you're not working on your own on this. You're working with the person, but you're working with partner agencies who are involved or need to be involved with the person. The Brent Safeguarding Adults Board strategic priorities set out that self-neglect and hoarding must be treated as a shared responsibility across agencies. Our key expectations are all partner agencies are expected to engage when asked by the lead agency where appropriate. The agency holding the case is responsible for arranging a multi-agency meeting following the agreed framework, which you will see in the toolkit as one of the extra resources. It's not necessarily down to adult social care. It's which is the key agency holding the case, working with the person who needs to be taking responsibility for that multi-agency meeting. Each agency should keep clear data on self-neglect and hoarding to help shape services, support decisions, highlight trends and gaps, and track local practice. As we saw in the national analysis of Safeguarding Adults Reviews, self-neglect is a major feature in SARS. So what is it? What's going on? How do we know what's going on in Brent or parts of Brent around self-neglect and hoarding? Are there any particular trends? Are there any demographic? Is there anything that we need to take notice of? It's up to each agency to have that data about their services and their involvement with self-neglect. And we should be learning from SARS. We should be learning from situations around self-neglect and hoarding to help shape our services. So are our services acting so rigidly that we're promoting self-neglect and hoarding because we're not enabling people to access our services? A professionals meeting should be held at the earliest opportunity with multi-agency partners. The lead agency should have explored ways of working with the person and involved other partners where possible. But early referrals are still encouraged if needed. Let's just have that mantra that we don't walk away. Even if the person doesn't want us, if we're concerned and that this is going to escalate into something major, what are we doing? We need to come together, because there might be something that an agency can do, or what we can do together might be better than what we can do alone. Of course, we should, again, consent before discussing with other agencies, but if it's refused, then if we've got a situation that is going to escalate into major self-neglect or significant hoarding that could affect other people, then we've got the reasons and the legal grounds for sharing information, but just need to make sure that we've clearly recorded that. Another section is around managing risks, and a particular focus is around fire risks. This has come up not necessarily in Brent, but in other local areas in London. So managing fire risk in cases of self-neglect and hoarding requires a coordinated multi-agency approach that prioritises both safety and compassion. This builds on that working together, so then the joint risk assessments, regular home visits and involvement of fire services can be crucial in creating tailored risk reduction plans. How are we working with that person to really manage any fire risk to them? Ultimately, safeguarding individuals in these situations means integrating health, safety and support strategies while ensuring legal and ethical frameworks are followed. This toolkit isn't saying that addressing self-neglect or hoarding is an easy thing to do. It does take time. It takes effort. It takes understanding of the legal and ethical frameworks. So that brings us into the next area, which is legal literacy. When someone is self-neglecting or hoarding and either unable or unwilling to engage with support, a range of legal tools may be used, depending on the level of risk, capacity and the person's circumstances. And this legislation helps professionals manage health, safety and safeguarding risks while upholding individual rights. Legal tools are most effective when used in combination with support, engagement and partnership working. The goal should always be to reduce risk while preserving the person's rights and autonomy wherever possible. So the toolkit gives you some access to some of the key legislation, but just again, coming together to think about how do we maintain this person's rights and what legal frameworks do we have. As in the previous toolkit, we've transferred over a section on homelessness and self-neglect. As you be aware, homelessness is a very key feature for the Brent Safeguarding Adults Board. And here in the 2021 review of Safeguarding Adults reviews across the country, they looked at those linked to homelessness. So that was 40 Safeguarding Adults reviews from 2011 to 2021. And these highlighted serious risks when self-neglect is not addressed. Many people in these reviews became homeless through relationship breakdown, poverty, unemployment, no recourse to public funds, domestic abuse, cuckooing, or being unable to stay in hostels due to antisocial behaviour, aggression or exploitation. So this goes far beyond what we might usually look at as standard adult safeguarding. It goes into the community safety aspects a lot more. And these people's experience often included adverse childhood events, trauma, mental and physical health issues, disability, substance misuse, self-neglect and sometimes suicidal thoughts. So what they found in the reviews was that Key practice shortfalls included discrimination and assumptions about unwise choices, preventing action, poor understanding of self-neglect, especially with alcohol or substance misuse, missing or delayed assessments of risk, mental health and care needs, disagreements about mental capacity, or poor partnership working and lack of coordinated plans. So you could see some of those areas were featured in the more recent national SAR analysis. So there's something that we're still not getting right about assumptions, about unwise choices, getting that understanding of how someone is self-neglecting if they're misusing alcohol or substances. The issues around sort of delayed assessments for health and care, which in the era where we are really strapped for resources and that time to be able to do these things, that is an issue. Or disagreements about mental capacity, which have come up in some Brent safeguarding adults reviews over the last 8 or 9 years as well. And we've recently had a task and finish group to look at mental capacity and identified that we needed to strengthen our multi-agency training around that to really look at it's not just a question of whether or not they've got capacity, what's underpinning that, their executive functioning. And that poor partnership working, where we've emphasised in the toolkit about the importance of that partnership working. And so with the toolkit, we have some accompanying resources. The top one there is the process around self-neglect and hoarding. This goes into what's in depth in the toolkit about recognising those signs, assessing those risks, and what do you do? And then also there's an assessment form there as well to really help you to sort of think about what other agencies are involved and getting underneath what's going on. So thank you very much for listening to this. And if you would like to find out more about self-neglect and hoarding in Brent, then please do look on the Brent Safeguarding Partnerships website, where you will find the toolkit and the additional resources. Discuss in your teams, whether you're within the council, within the NHS, within the police, or within voluntary services. Please do discuss within your teams how you come across self-neglect or hoarding and what you need to do about it, and are you following the toolkit? We'd really like to hear back from you about your experience of using toolkit. Is it helpful? Does it do enough? Are you still finding challenges in being able to work with people? So, or you find something from elsewhere that's been really helpful to you? Then we are really willing to hear from you. And we want to see this toolkit as being able to be quite live, and we can evolve it. If you find that partner agencies don't seem to be following the toolkit, don't seem to be using it, and so that you're not managing to do the partnership working together, then do remember that there is an escalation policy for the Brent Safeguarding Adults Board as well. So we want to hear from you what's working well and what could be improved. So thank you for listening.